let's broach autoimmune issues a little bit. What do you think? What do you think is going on? I mean, we're seeing more autoimmune issues. Interestingly, it tends to favor women than men. There's a demographic breakdown where women tend to develop autoimmune diseases more than men. Some people would think, well, it has to do with pregnancy and being exposed to fetal antigens. And I look at it like, well, women eat a hell of a lot more vegetables than men, and it's true. They literally do. You can look the statistics up. Women consistently eat much more fruits and vegetables than men do, and they get higher rates of autoimmune disease. Now, again, that's a stretch to make an assumption based on that, but it's an interesting relationship. What do you think's going on with autoimmune disease, and why do you think a carnivore diet? I'm sure you've seen it has been so effective at improving or mitigating that.
Yeah, no, I've seen amazing results with autoimmune issues. I mean, we have many patients at our clinic with Dr. Rensburg that have Hashimoto's thyroiditis, and they're all improving dramatically. Most of them will get full resolution in a year, or at least significant improvement. All their antibodies are coming down and everything like that. There are several studies. I mean, obviously, going back to like the 1800s, Dr. Salisbury, he was describing, very, very good results with pure meat and water diet. As recently as 1975, there was the Stone Age diet. I forget exactly.
Yeah, Walter Volkmann. Yeah.
And and then everything just got completely thrown in the bin as soon as that declaration from the USDA came out, and they just ignored it and said, "Well, fat's bad, meat's bad." But there are even more recent studies that show that, like an elemental diet, where you're just giving people the macros and micros that they need just to live, without all the rest of the crap with it. That this had better efficacy in getting people with Crohn's and ulcerative colitis out of flare up than prednisone, and that fasting mimicking diets were used as well. They found to be very successful, which is a keto diet, right? And they found that in these two populations, with the fasting mimicking diet population, they on average stayed in remission for 51 weeks, while the group that ate carbs and fiber stayed in remission on average 0 weeks. So there's a big difference there. There's a really good lecture by a guy, Dr. Paul Mason, out of Sydney.
Yeah. I know Paul. I've had dinner with Paul, and
nice.
I've met Paul many times. Yeah.
Yeah. No, I haven't met him myself, but I certainly respect his work. He's done a lot of good things. He has a very interesting one on lectins for low carb down under, and he shows that there's you get these sort of leaky gut, like usually from gluten and things, and then things can sort of slip into the system. One of those things are lectins, and lectins can cause all sorts of hell in your body. And one of the things is that your body attacks them with antibodies, and you get molecular mimicry. So they're similar enough to certain cells or proteins on your cell that your body, that these antibodies then spill over and start attacking. So he was sort of making the case that. And quite a good case that this was precipitating autoimmune issues was just the lectins. And so whether it's lectins or whether it's something else, your body's sort of attacking something, now it's slipping over onto your own cells. And so if you eliminate all those things out, and you heal your tight junctions in your gut, and you're not getting leaky gut anymore, and things are just working normally, you're not getting all these things in there, and they're not going to be making the antibodies, you're not going to be attacking these lectins or these other materials, and then those aren't going to spill over and hit your own cells. And I think that's probably a very, very plausible mechanism.
Yeah, I mean, I think there's the work of a fellow by the name of, I think it's Alessi Faisano out of Boston Children's, has done a significant amount of research looking at the relationship between gut permeability and autoimmune disease, and I think there's pretty interesting work there. The other thing we're seeing a lot of is resolution of mental health disorders. There was a study just published, I think George Eade and Eric Westman and a couple others published a study looking at a retrospective analysis of, I think, 31 patients that were admitted for either major depressive disorder, schizoaffective disorder, or I'm trying to think of the other one, bipolar. And they saw the vast majority of them, all but I think one, showed significant clinical improvement. And in fact, I think up to a third of them showed complete remission of all their symptoms. These are people that were hospitalized, that were refractory to all medical treatment. And so after a period of, I think it ranged from a week to several months, that they were able to completely resolve that with a ketogenic diet. Now, in my experience, I think a carnivore diet is probably even more efficacious than a ketogenic diet. Are you seeing issues, mental health resolve in the people you're talking to, and why do you think that might be?
Yeah, I've certainly seen that, especially with like depression and things like that, and people's just mood in general. They feel much more stable. They feel much more just happy and normal. There have been studies in I forget exactly what in a psychiatric journal that I read a couple of years ago. They were showing that there was a relationship between LDL cholesterol levels and depression, major depression.
Sure.
And so the people having lower LDL, having much higher rates of depression, and more concerning was that those with low LDL and depression had a much higher rate of suicide as well. So it was obviously affecting them, quite severely as well. I spoke with a clinical psychotherapist, Natalie West. She's over in Sydney as well. And she was going through quite a lot of the literature. And she was saying that in her practice, she's been doing this for 20 years and in practice of other psychiatrists and psychotherapists, that they were actually finding this exact same result, that even like borderline personality disorder and bipolar and schizoaffective disorder, that they were finding that they were resolving these issues, and certainly for major depression as well. I think there's a number of people that have resolved their major depression, which is amazing. So it's such a debilitating issue, and I mean, goodness, schizoaffective disorder, like that's probably one of the worst. And these people are having auditory visual hallucinations, all of a sudden they're gone.
Yeah.
And I don't know the mechanism for that, but I think it's very, very interesting. Obviously, something is going on. You're having a combination of some sort of toxicity is screwing up with our brain chemistry, and or you're having malnutrition from the cholesterol side of things. We're not getting our brain as much of what it needs, so we're sort of hurting it and not replenishing it. And I think that combination in the genetically susceptible are going to have serious psychiatric problems.
Yeah, there was an interesting study out of Stanford University, I think 2018, where they looked at actually carnitine levels, and low carnitine levels correlated very nicely with major depressive disorder.
Oh.
Now, carnitine we make endogenously, but if we're not taking it exogenously through, i.e. meat, then it tends to be on the lower side. And so you see that in a combination with low cholesterol and low iron and low zinc and all these other things. And all of a sudden you've got a recipe for mental health disaster. And I think we're seeing that in society as a whole. I mean, we're seeing literally the fabric of society eroding through. Everybody is just malnourished, and it's affecting their brains. And we can't even, like you said, chilled out and happy is where we're supposed to be.
Yeah.
And everybody's anxious and stressed and pissed off and, at each other's throat. It's really sad.